back to Hometown Headlines Radio Edition for this Thursday morning. A lot of headlines out there this morning. Very busy news day out there. One of the top stories of the day regards EMS service here, not only in Floyd County, but in our region as well. Here to join us talking more about that, Bud Owens from Floyd EMS, also Dan Sweitzer, Floyd's Vice President of Market Development. Gentlemen, good morning. Big announcement yesterday came up on Floyd Straightforward, Kurt Stunkel's blog, about what the latest development was and the possibility of a sole provider concept. Basically, you guys are staying the course with Floyd EMS. What's it all about?
Well, John, thanks for having us here. As you know, Floyd is a community not-for-profit hospital owned by the citizens of Floyd County, and we have a responsibility to provide high-quality, cost-effective service and to evaluate anytime there's an opportunity to look at improving our services or reducing our costs. And EMS is a very important service to our community. It's important to Floyd, but it's also very expensive service and one that we lose a significant amount of money on, and there's no subsidy. Floyd receives no tax subsidy at all for anything, and certainly not for EMS. So when Redmond CEO John Druckenmiller called Kurt and suggested that the two hospitals work together to see if we could identify a single vendor that could serve the entire three counties and do it more cost effectively, we thought that we had an obligation to do that. And so for the last 6 months or so, we have been working with Redmond and with some consultants to evaluate the feasibility of combining the two EMS systems into one, essentially, operated by a well-qualified vendor who already serves the state. We sent RFPs out to a number of vendors and had exhaustive meetings with two companies that would have done a really good job. But what we found over the last couple of weeks is that the subsidy required for them to come into Floyd, Chattooga, and Polk counties to operate was significantly higher than the cost that we had at Floyd, the loss that we had at Floyd right now. And it became pretty clear to us that that wasn't the solution to this issue. So we met with Redmond yesterday and told John that we were no longer going to continue with this process.
All right, so that stops that process after all this studying. Again, it would not have been just Floyd County, but it would have been really the total market. Chattooga, Polk, okay, the three-county area did not add up. You talk about losses in it. No, I mean, currently you guys are at a loss. I mean, we're talking the numbers here. Any ballpark figure you can share on that?
Sure. There are definitely losses in providing EMS in any community, and most communities that have an arrangement with their county governments, they do have some subsidy dollars coming in, and we don't have that advantage here in Floyd County or in Chattooga or Polk. But we have worked significantly to reduce our losses over the last several months, and we have some plans in place now that we're going to be implementing that will continue to reduce our losses, but allow us to provide an exceptional level of service. Floyd EMS has been in business for 48 years. We're the longest serving EMS provider in the state of Georgia.
I was surprised to read that yesterday. I did not know that. Yeah.
Of course, Floyd Medical Center being the first trauma center in Georgia, you know, so we've got a lot of history here, and we wanted to keep that intact. We've got a history of providing exceptional services to the citizens and the visitors to this community, and we want to make sure that we continue to provide that. So we're going to be very cost conscious as we go forward to make sure that we're able to continue providing that long term.
Well, I know when this first came up, there was concerns about what happens to the employees. If I'm wrong, let me know if I'm wrong on the scenario here. But basically, the employees would have been absorbed from both EMS services with a new managing partner. I guess, is that the way to put it?
No, not actually. The plan was for both Floyd and Redmond to go out of the EMS business when the new company came in, and we would work with that company during a transition period. But ultimately, they would be in operation. And they would offer employment to a number of the Floyd and Redmond staff. Probably not all. There are. We both agree, Floyd and Redmond agree, that there are more resources right now that are applied to the three-county area than is actually needed by the area. And in part, that is because we're competitors, and so we offer duplicative services. And the thought was that a single vendor that wasn't a competitor would be able to become more efficient in their operation and not have a lot of duplication. Turned out not to be a significant difference in terms of the cost. The further answer to your earlier question, Last year, our EMS service posted a negative $3 million, a loss of $3 million for the system. This year, Bud and his staff have done a great job of reducing those costs down, and we're expecting it to be around $2 million. But we will continue to work on that, and we think that we can get that number lower.
Again, the story coming out yesterday, had been an agreement or been a discussion between Redmond and Floyd about possibly a united one service kind of taking care of the regional thing. That now has been abandoned. The numbers came together, and we got our guest here, Bud and Dan. The numbers basically, it sounds basic, but I mean, just didn't add up.
When representatives of Redmond and I made the rounds 4 or 5 months ago to all the county commissioners and county managers to talk about what we were looking at, and we committed to them that we would only identify high-quality services that they would be happy to have in serving their communities, and that it would not be a burden on the taxpayers in those counties if we brought in another service. And so as we evaluated these proposals, we really tried to put ourselves in the eyes of the Polk and Chattooga County commissioners and the citizens in those counties, because although the hospital is located in Rome, we certainly serve Polk and Chattooga County, and particularly in Polk, where we're building a new hospital for the community. We're very invested in the outcome of health care there, and EMS is a very important part of healthcare services. And so we wanted to make sure that we had a great service for that county. And we told the commissioners that they would have an opportunity to evaluate any proposals that we came up with that we thought met the level of quality and were cost effective. And I've already reached out to the commissioners to go and meet with them next week, hopefully, to explain to them why we felt that although the applications we got, these two companies would have provided very high quality services. They're excellent companies, great reputation. I think they would have done a good job for us. But the level of subsidy that they proposed, one of them $4 million a year, the other close to $5 million a year, was beyond what we thought was appropriate, and that we could do a better job of keeping the costs down. Because that $4 or $5 million subsidy would have to be passed on to the citizens of the 3 counties in some way. Even if we absorbed it at the hospitals, we are not for profit. We'd have to pass those costs on. So our costs are $2 million. Our subsidy arrangement would have been, we're not sure, we didn't get far enough along to divide how that $4 or $5 million would be divided, but it may be close to $2 million. There's not really any financial advantage, and we think we can reduce those costs down significantly below that.
We have about a minute and a half left, guys. But what is the average expense of a EMS trip? Say someone's having a heart attack, they go to the house. What's that cost incurred?
Well, the actual charges that you're going to get are typically around $800 plus a mileage charge, a patient-loaded mile charge. So you're looking anywhere from $8,000 to $1,000 here around Floyd County specifically.
And that's for the patient itself. That's before anything else. So that's we're being charged $1,000. Your cost has got to be more than that.
Yeah, our costs are extremely high. Paramedics and EMTs are highly trained employees. We do pay them a very good wage, provide good benefits, and then just the cost of the equipment and the services that are provided is high as well.
We've got about 35 seconds left here, guys. It is a quick loaded question here. I talked about very thing at the end of Kurt Stunkel's comment, talks about looking at possibilities of other things going forward. Anything short term we should look for, EMS, any other changes or enhancements?
We'll continue to look at making changes and looking at ways to reduce our costs. Next week is EMS week. We will be celebrating with our employees and with other public safety folks the great job that these are heroes in our community, the services they provide. We're pleased that we were able to make this announcement to them before EMS week, and relieve some anxieties that they had about employment.
Oh, I bet.
They will continue to work with us to help reduce costs. They've been a great asset to us through this process.
All right, guys, thank you for your time today. Time for a break. Hometown Headlines, your radio edition.